I want to open by thanking everybody for joining in our discussion on COVID-19 or the coronavirus. It's no secret that the effect of the coronavirus on the health of racial and ethnic minorities, minority groups is still emerging. But we know that some of the current data that's available, it actually suggests that there's a disproportionate burden of illness and death among racial and ethnic minority groups, and in particular, Black Americans. What we do know is that history has shown that severe illness and death during the time of pandemics is much higher in ethnic groups, especially, as I said, African Americans. And so this is why I've invited Dr. Moshe Lewis to actually come on and on the show for us to talk about and to just simply have this candid, raw, lit discussion about the coronavirus. So Dr. Lewis, by the way, is actually he's, first of all, he's just a dope physician. But the other thing is he's the founder and CEO of Golden Gate Institute for Integrative Medicine. He's an Ivy League trained physician who's board certified in physical medicine and rehab, and we can talk a little bit more about that. But what I liked about it is Dr. Lewis's approach and take to how we need to be dealing with and looking at the coronavirus. So Dr. Lewis, thank you so much for tuning in and joining us today.
Absolutely, yes. It's my pleasure to be here.
All right, so let's jump right in. I want to start with, first of all, let's remind people what the corona or COVID-19 is. We hear that, but what is it? I know people kind of ad nauseum, but really, let's just kind of revisit that.
Sure, keeping it really simple, it's a new virus. But as much as we use the word new, we've seen coronaviruses before. They happen during the summer. Many people can get them sometimes in the winter, but this new strain is a lot stronger. And the only disclaimer I like to put out about that is that it means there's a lot of things about it we don't know.
Right.
We're all getting used to new technology. We're getting used to maybe a newer way of life for many of us, certainly in the healthcare community for sure. And that can definitely be uncomfortable. And many times we want to try to provide these types of answers, which is why I'm so happy you're doing this show, so that it can help be powerful. Knowledge can help calm people from being stressed out, as opposed to rejecting it and saying, oh, it's new, it must be wrong, I can't accept it.
Right, absolutely. But even more so, you heard me in my opening comments, I talked about the fact that when we talk about the coronavirus, this pandemic, how it's disproportionately, I can't even say that word enough, disproportionately affecting African American people. So let's just talk about the racial biases and the effect that it has on healthcare, because this is real. And that's why I wanted to have this discussion. We need to get past all the fluff and stuff, and let's get real and let's really talk about what's really happening, what's going on.
Exactly. So, and I like that honesty. I think we just need to just come straight with it. And what it does in this particular case, COVID, is I like to use the word, it lays bare our weaknesses. We know that health in general is something that affects communities of color pretty much around the world disproportionately.
Right.
When it comes to having the access, having the money to get the medications, having the access to the experts, having the ability to get into the big mega centers, being told about a procedure or surgery or medication that might work, many times we simply are not told. And we're certainly not told as well and as quickly. And picking COVID in particular, I listened as we did these roundtables around the country and continue to do so, to literally hundreds of patients over the last couple of months tell me they were turned away, told to go home, told it wasn't a big deal. And for at least me in my practice, because I was getting a lot of these calls from patients who were worried, concerned, or had symptoms, our teaching was treat. You treat regardless. Now, we know we're not treating COVID per se. Even as of today, we do not have an official treatment, but we treated the symptoms that patients had. And at the very least, we provided some of the kind of education we'll get in today about what to look for, what's going on, and when it was necessary to actually go in and see the doctor or go to the hospital.
Okay, all right, thank you for that. One of the things when you and I were having this discussion, I was talking about I want you to come on. We hear this word thrown around, comorbidities. I'm from the South. And my whole thing is you need to like keep it simple because all this, oh, what does that mean? So break it down when you're hearing health officials and physicians and nurses, they're talking about comorbidities. When you're talking to patients, a lot of times, and patients of color, you need to be real. You need to tell them exactly what that is. Quit using all of that. To me, it's superfluous. Tell them what the real deal is. So break down comorbidities for us, Dr. Lewis.
Exactly. So in our community and in general, communities of color, but definitely worldwide, high blood pressure in particular, if your blood pressure is running high, if you also have diabetes, those have been identified as two of the big diagnoses or other existing diagnoses that place people at tremendous risk of getting pneumonias, viruses, and certainly getting COVID.
Mm-hmm.
In our community, we were also worried about asthma and smoking in particular. And there may still be some debate about that. All of us are trying to literally keep on top of what is the best advice. But certainly one knows that if you're taking, to be specific, prednisone for a diagnosis, if your age is older, you're over the age of 55, 65, 75, these are all factors that we get concerned about, that if a virus comes along, as would be the case for anybody in flu season, that person is at a higher risk.
Right.
Back to our first question, since there's a concern that our communities have more diabetes, more hypertension that isn't controlled, those numbers are not as perfect as they should be. Maybe if we splice the numbers a certain way, we can show that we don't have as much as another group. But when you use that word disproportionate, we have more uncontrolled. And lastly, just breaking that word down, so keep it simple.
Okay.
Cousin BB not taking his medicines because he can't perform in the bedroom. Sister Ray Ray, she's saying, oh, I would get that Trulicity, and I'll pick on a specific medicine that costs hundreds of dollars, but I don't have that. I need to
Right.
get to my doctor and get a generic, and they said I have to come in. Oh, but the offices are closed. So we have these real barriers that exist when expensive meds are used, when we're not checking our blood pressure, when we're not aware of how high our sugars are, and or we're not taking those day-to-day steps to keep it under control. Then along comes COVID, or along comes cancer, or along comes any other disease or illness. It could be a hip fracture from a fall. And if we've got diabetes that is not controlled, we're going to most likely have a worse outcome while they're trying to control the diabetes and deal with the hip fracture.
Right, right. And in fact, I just want look, this is just like a side note when you're talking about, the gentleman who won't take his blood pressure medicine because he can't perform in the bedroom, or, for Miss Ray Ray who can't afford that, $100 a pill med. One of the things also, just as a side note, is that people, and what I find we're going to get into talking about also the disproportionate treatment of Black patients, because as a physician, and you know this, there are a lot of times you have samples. And for me, I've always been an advocate for you being able to give a patient a sample before they go out and spend all this money on a drug that doesn't work or has a lot of side effects. So that's another show that we'll be able to talk about. But you're absolutely right. And those underlying conditions that you just talked about, those are the things for people who are tuning in. By the way, guys, be sure and tag somebody, have a watch party. Thank you guys for joining. The thing is that these conditions that we're talking about, the diabetes, the high blood pressure, the asthma, and the age, that is what they're referring to when they're talking about comorbidities. But the doctors and the nurses need to just be able to say, look, you've got this condition, this condition, this condition, and it compounds what is already going on. And that's what we know. So thank you so much for breaking that down. But let's talk about some of the more prevalent healthcare disparities that actually affect people of color, especially in relationships to the Affordable Care Act or Obamacare, which we know the current political climate or people in Washington, it's like, no, that is not that is not what we want to see. But I think that by not having Obamacare in place, something that has helped thousands, millions of people be able to go to the doctor and get care. What are your thoughts about the fact that we really need to have health care that I believe for all, not just for, the rich and famous few?
Sure. So that raises a good point. So I feel that this disease helps, the word I'll keep coming back to is sort of lay our weaknesses sort of out there in the open. And when I say
Mhm.
our weaknesses, I'm talking about weaknesses in America as a country and also in the healthcare system in particular. If we don't have healthcare coverage that is more accessible and affordable, eventually those that are rich and have more access because they've got the money wind up being responsible indirectly. And that is that you have this, you have hospitals that are overwhelmed, the people that work there certainly make a living, but their lives are at risk. So all of a sudden, where before it was a job and one might feel bad and certainly felt altruistic about helping people, now all of a sudden having an overwhelming number of people who are very, very sick has challenged our healthcare workers as well in terms of their safety and their risk. So in other words, we can't afford to neglect healthcare for everybody and figuring out a means to provide it, because
Right.
little by little, that person that you're walking by, that it doesn't matter where their financial status may be because you're capable of walking, but they're sick,
Right.
may potentially get you infected. So I definitely agree with you that not taking healthcare seriously as a nation, and then when we drill down to the insurance, accessibility for our community is always a challenge. First, there's an issue of trust, and we're seeing that arise in
Mm,
other arenas that we're
yes.
not
Yeah.
going to get there. I think as a people, we're trying hard to trust and to believe and listen to doctors and the medical. There's an issue with the confusion, hearing different messages. And so many times people will light on that. They'll jump on the fact that this person said, wear a mask, that person said, don't wear a mask. So sometimes people use, I call it exploiting the controversy. I know
Right.
what I think is right, but because there's some controversy, not everybody agrees, I'm going to go with, a different side.
Right.
Um, but access, affordability, and for certain clear messages are a challenge in our community and something that we need to fight for. The same way we're going to fight for when some of the malls open, the lines, and I'm not saying I knew who was on those lines, for the Air Jordans was around the block. We need to be rallying in the same way for access to
Yeah,
healthcare.
absolutely, absolutely, and that leads us into the question of how the lack of medical coverage has impacted people actually going to the doctor and seeking treatment, because there have been so many people who don't go, and we know that even if we're just looking at some of the basic stuff, high blood pressure, swimming in my head, whatever it is, because they don't have insurance to go. So not having that medical coverage, especially in this time with Corona, what would you say the impact has been overall?
Yes. So for sure, many people were hesitant to go out at all, which we still want people to get out, especially now that most cities are reopening, and walk and get some exercise.
Right.
That's good for their lungs. That's good for their overall health.
Mhm.
Um, and then more importantly, we want people to call on those resources. Some of these monies that were out there through the CARES Act and big programs like that have trickled down to, and we've heard that from some of the people that had called in, and we appreciate your calls and participation, by the way. If you've got questions, feel free to throw them into the
Right.
chat there. That have trickled down to the community level, where you will see departments of public health offering testing, offering availability, and also offering local neighborhood clinics so that people can actually get access. And we always say that saying, the squeaky wheel gets oiled.
Right.
Other communities make sure that they also are vocal for what they need, even though they may sometimes be impoverished or have a lack of resources as well. We may often presume, oh, community X, they've got it going on, and there's
Mhm.
no one that has financial strains in that community. And so if they need to see a doctor, they'll see a doctor. That's not true. And all of us who take care of patients see a broad swath. We see patients of all different ethnicities walking in the door all the time with Medi-Cal, no ability to pay. I need a discount. I can't afford to pay this visit. What can you do for me?
Right.
HMO,
Right.
care, and then the PPOs. So we want our community to not be afraid to say, I need to get, cousin Nene in because she's not well. Let me see where I can get her. My mother's really been coughing a lot. I need to get a checkup. How can I make that happen? Let me call on everybody I might know that could help provide me access so that I can get in, as opposed to simply saying, I really can't afford to do a copay or see the doctor or pay their rates. I think I really better take care of this big, grapefruit of a mass that's on my side and just leave it be because it'll be fine.
Right, right. And something that's interesting, you also bring up another point. When people don't go to the doctor and when they seem to get sicker, this is why our ED departments, our emergency room departments are overrun. We have people who show up in the ED because they know that they can't get to the doctor or see the doctor. And that also causes a burden on our healthcare system as well. But we know that the country is starting to slowly open up. And it's so some, depending on what news media you're listening to, they're saying that the coronavirus seems to be slowing down some, but in what they're saying is it's getting better. But we also know that some of the areas that have reopened, even slowly, that new cases are emerging. So my question to you, Dr. Lewis, is this: why do you think that some physicians have been much slower to recommend testing for corona as opposed to other patient populations? Because you've seen some people are getting tested. Now we have more tests. Should I get tested? When should I get tested? So can you speak to that?
Sure. And you're right. You were hitting on the hot button of every sort of medical debate that's going on right now in the world of testing. There is still some controversy there and will continue to be until the tests are even more perfected. Mm-hmm. That said, today's recommendation, literally as it stands, is that if somebody is at high risk, so you work in a daycare, you work in a nursing home, you want to visit your relative that may be in a medical setting, you're taking your child to school, as some of those are opening, not the larger public ones, but some of the smaller ones are opening, and things of that nature, some of the day camps. And you're concerned about your risk because you may have asthma, or you may be a little bit older, not much older, maybe you're 52 or 61. Mm-hmm. It is reasonable to say, okay, let me find out where the testing is available. Almost every county has a program now. Most of them, why I pick on counties, because those tests are free. There are requests, and pretty much has been the case for the last 2 months, a test that the insurance will cover, at least in part. Many of them are charging a copay, and that's something to sort of navigate. Okay, if I'm with Medicare and Medi-Cal, to be blunt, is it covered completely? And Quest should be able to have an answer for that. But the Quest test, the test that they're doing, which would be the lab blood draw, is kind of the more recent one. It provides a little bit more information about how your immune system is responding. Sort of the first and somewhat older test, which takes a swab, sort of tells you, okay, today, do you have that test? And again, the best advice, so that we underscore it, is that if you are at risk, if you work in a healthcare setting, if you work somewhere where you will be around the public a lot, and you're concerned, or your employer wants you to get tested, go. Flip side, just so we're clear, we're flipping sides.
Right.
I am younger, I am healthy, I don't have symptoms, I am working from home for the next few weeks, I'm furloughed because I can't work, and we don't want that to be the case, but we'll talk about economic realities in a moment.
Right.
I don't have work, I've been laid off. I'm a little bit older, I am 52, but I don't have medical illnesses, or my blood pressure is under control. There isn't as much of a rush for those people to get tested, because the tests are still in evolution, with only 3-4 months, some may say 6 months on the clock for a new diagnosis, which is why we started there. These tests are still not perfected, and we have to be very clear on what a positive test means. Right. And leaving there, we'll pick 2 public examples, one in the White House where they were doing the swab test and there was negativity the first part of the week, and then a staff member was tested, same staff, same place, still being tested, and it changed. And that was your swab test. Do I have it today? No, but tomorrow it can change. Then there's your blood test, which is giving you much more data about how am I responding to a possible exposure? Have I mounted an immune response? So we think that Right now, patients can certainly benefit from both, but because the average person who feels well and is not in a crowded setting will not necessarily know how to best deal with that data, it's okay for them to wait.
Okay. All right. So with that, we'll jump in. We're being raw. So the thing is, what do you think is the premise behind people of color not wanting to get tested? Because even when they started saying, "Oh, we're going to make it available," we know going back to Tuskegee, we know going back to Henrietta Lack. Uh-oh, we lost you there. We know that that is not the case. So can you talk or speak to that? Uh-oh. Let's see. We lost you, Dr. Lewis. He will be back. You guys, not quite certain what happened. He popped off there for a second. So let's see what's happening. All right. Technology, you gotta love it. Don't go anywhere. For whatever reason, this, you know, this happens. So let's see. All right, Dr. Lewis. You went off. Guys, if you're just joining, we have been talking, having this candid, raw, lit discussion with Dr. Moshe Lewis, who we're discussing the coronavirus and what's going on. And we just had a situation where he, for some reason, for Zoom, ended up popping out. But I'm certain that he will be back. Um, and so, I don't know who's asking, how do I know Dr. Lewis? I've known him for a very, very long time. And he is a physiatrist and has his own practice. So here we go. We'll bring him back. We're bringing him back. All right, Dr. Lewis, are you there?
I think we were too raw.
I just said technology. That's the thing. But I guess when I ask you that question about, the premise behind Black people or people of color not wanting to get tested, you popped out at that point. But let's really talk about the medical mistrust that is and has and does still exist because of the suspicion around healthcare providers, healthcare organizations, etc. So can you speak to that, please?
Sure. And I've had people just frankly come right up to me and say, Doc, is it true that this test is already positive and then you're going to tell me I have this and it's a dangerous sentence. So it's very real and it's definitely a legit concern. And I think that our community has to do more, which is the reason why I'm reaching out. Mm-hmm. And I want all docs, I mean, to me, us doing this is a call out to tell docs, give people that extra time, explanation, spend the extra few moments that it takes to have them understand that you sincerely care. When that comes across, I think people realize, no, my doctor will go the extra mile. They may call me late. They may send me an email. They may talk to me on the weekend. They may take just those extra few minutes from time to time. They see me regularly. It's really important. Again, this is the call out for physicians. We realize that distrust is going to exist there. As a doctor, I can call on all my colleagues to say, please, go those extra miles. I can't tell you when I get the calls from all around the country because I hold a few different licenses. And since I've been doing telemedicine now for a while, I'll tell you, and it's not every nation, but I literally have maybe about 8 different countries that I get calls in from on a regular basis. Venezuela, Brazil, Australia. I had a call from Saudi Arabia yesterday, and I get a few clients from Canada on the regular, rarely from the UK because of the National Health Service. I bring that up to not brag, but to say these people shouldn't be calling me. They shouldn't need the sense to, but they're calling sometimes out of their own countries because they feel capitated. And by that big word, I mean, they feel like they can't get an answer from their own doc. And one of the questions that I always ask, usually sometimes in the beginning, but definitely before we part, we usually have 30 minutes to do these consults by video, just like we're doing now, is where is your doctor in the mix? Of course, and we've done the math, more than half the time they don't have a doctor. And so that's understandable for why they're reaching out. Okay. But the other 40% in general are, I tried to call the doctor, I can't get in. The office is closed, they're not available. Now, let's be fair. The entire nation, not just in the US, but all of the other countries I mentioned were on a state of lockdown. As I continue to get these calls, people shouldn't have a difficulty reaching their doctor when you can't travel anywhere.
I agree.
I don't care if that means that you've tucked yourself away somewhere beautiful and remote in country and you call into your answering machine or your service to get the messages that piled up over the weekend or that night. But again, I'm calling on docs, and I'm just being specific with the example to say we have to be willing to take those steps. We ran to the front lines to serve when there was that need to serve. We know that's disappearing now. The ERs are emptying out, the floors are emptying out, and we hear those data from around the world. We can dial into almost any governor or country and find out where they are today in terms of the cases. In terms of active cases, it's down. So I want doctors to be available, because then, to get to your question without belaboring it, how are we going to give that trust if we're not available? If we won't take those calls, if we won't serve our patients and tell them, I care, let me counsel you a little bit about getting this test. Let's weigh out the benefits and the risks for you.
Right.
But to put it to bed, we are going to be concerned as a community. We feel like we've been led down the path before that's wrong.
Right.
We feel that there's a lot of reason to stereotype or stigmatize us with, oh, you have the COVID, you got the Rona, okay, you can't work here. And let's just be real, that's what we fear may be coming. You can't eat. We saw it with HIV. So it's not as if this could be a new thing, and maybe you might have a concern about your insurance policy. That's the real. You might be concerned about being able to tell people that you're positive and what that may mean, whether it's something smaller like dating somebody new versus work versus, like we said, something that may impact you significantly financially. So we understand that. And again, I think that if people aren't high risk, we realize they may say, let me wait. But on the flip side, let me also be careful. And I know we'll drift into it, but that's how you're taking the precaution. Since we're still working out the tests, since they're primarily geared to risk, let me protect myself and my community, regardless of what other people may do.
Right. I'm going to allow you to take a question that has come up. One of the questions is do you find it appropriate to open or start opening businesses to the public? And, someone watching is inquiring about that.
Sure. I think there's a real financial, and some people may call it a political push to open, because the bottom line is that the less that people can go to work, the more they're cooped up. The realities of losing health insurances are very real at driving what people might call, the poverty of COVID. Okay, it came and did devastation in terms of death, made a lot of people sick and put in the hospital. Now it's having a tremendous impact around the world. If people can't go out and work and make a living, that makes them sick in other ways. I don't have insurance. I don't have a little extra money to pay for medicine. I don't have the ability to get from point A to point B because I can't make my car payment. So I think it's definitely reasonable. However, there are certain settings where even all of us can say, okay, they're streaming those movies online. Do I really need to be in a theater at this time? I see that restaurant. It's my favorite. I just can't help stay out of. We'll give a plug for Cheesecake Factory. But it's packed to the hilt. Do I really need to go there? Or is it really more an entertainment value and I want to see NBC? I love to, and I need to get my nails did because it's been a little while and they're getting a little long and I might scare somebody. But there's 7 people in a relatively small space. Let me see if there's a time I can schedule where it's not quite so crazy. I'll wait till a Wednesday morning or a couple of more weeks. It's been a while. But so I just think those are the real factors. So putting it into more of a mnemonic, we like to say time, space, people, place. What time am I going to go and do whatever errand, chore, interaction with the public that I'm going to do? We know in general, people tend to get more crowded in some of the places we just mentioned as the day goes by. Earlier in the day, which is why the grocery stores and a lot of places opened early, it's going to be a little bit quieter. So that's what we mean about time. In terms of space, okay, it's hot. Let's be real. We don't know how to have air conditioning. we may want to get to the beach or the park. That's no shame in your game to want to enjoy nature. We want you to get out. But if there's 12,000 people on the beaches and you can't even find a parking spot in the lot, do you really need them to say, no, you need to go back home, we're closing the beach
Right.
to any more people to access? Or as we saw in a lot of the videos that ran around in social media this week, people turning around without a mask on themselves and saying, I can't believe all these people are out here without a mask on. So, okay, let me say that space is just a little bit too crowded. And for sure, I think that, clubs and bars, and we talked about movie theaters, these are gonna be some of the places a little bit harder.
Right.
The same would come with travel. You wanna put off because you had to do that vacation, that reunion or what have you. I'm not mad at you. It's a closed space. It's very tight. Then we said people in place. So people, how many people are here? There's nothing like being down at the barbershop and being able to really catch up on the social, things of what's happening with this team and who's going to be training and what's going down with that and who said so to whatnot. But okay, we're all congregating around and we don't need to spend that much time in there. So if it's crowded, every street's taken and we know there's not really enough space, that's okay. Yes, the barber, the nail salon person, the hairdresser will have on a mask, and we think it's appropriate for you to do the same, but the proximity is really close. So when we said people space, that's kind of what we mean. So that's sort of an easy way to sort of think about it in terms of, let me be cautious about certain settings that I know are going to be a bit crowded. If I'm in the mall, I'm going there for a specific reason, or that store, and I'm out. I'm really not sort of hanging out in the middle of the summer, just, in a store in particular. Now, I understand you may want to hang out in the general area and things of that nature. It's cool in there and it's able to relax. Maybe you take a lunch break at the mall. Tons of people do, not mad at you. We realize that people have to get out somewhere. But we rather that it's in parks and larger spaces and back in your communities.
Right. And it's about common sense too. This morning on CBS, one of the things that they highlighted was a young African-American man who went to some big party. And this is the thing, y'all, with the whole piece of social media. When you are showing everything that you're doing, well, he took a mask but didn't wear a mask. So he comes back to work, but guess what? His boss and everybody else apparently saw this video. And the reality of it was they sent him home to quarantine for 14 days without pay. So when he called the doctor to try to get an excuse, say that he was okay, the doctor said, that's on you. You knew we talk about not being in large groups and not, being socially responsible. And so what you're talking about is the time, the space, wearing the mask, get in and get out and doing the things that you need to do, and to do it as quickly as possible. At this point in time, it is just not about us just kind of hanging out and just chilling. That is not what it's about. But we want to be candid about all of that. And so I love the way that you couch that. So here's another question for you, Dr. Lewis. What about essential medical needs? My friend's daughter just had a baby, but she was so afraid to go to the hospital. What steps are being taken to protect in instances of essential medical procedures?
Sure. No, so that's an excellent one. And if any group is really trying their best to trip over themselves to be careful, it's the medical settings. They know there's a lot of liability involved. And again, I think when doctors and physicians that are treating patients care, they know they have to go those extra miles. So typically our patients are wearing masks. We've gone out of our way. I mean, literally even today, I was placing an order for 1,000 masks, because obviously I have to order at large numbers so that I have them available. If your mask is ripping, you don't have one, you just need one to be able to take so you can have it tomorrow or to give your niece. That's fine. That's what I'm here for. So I think you'll find that we're masking up, gloving up, and that in general, our biggest challenge will be sort of trafficking the patients. And I'm honest about it, because people have been in our offices and their own physicians' offices. They know that if there's a waiting room that's a bit crowded, they, same thing, may want to say, hey, I want to come towards the beginning of the day or near the very, very end of the day. I'm concerned I'm at a bigger risk. Most of the OBs I know did stay open for obvious reasons. That's really not something that's can be put off in any type of way, any emergency there. Many doctors don't know how to manage if they're not an OB. We don't see that every day. So they too have gotten very familiar with making sure that, again, people are gloved and masked accordingly. as we know, and it's a blessing, very few kids have been affected by this, even the youngest of the young.
True.
And it really is. I think that it's a lesson from above without trying to get too spiritual, but I think there are a lot of lessons that can come from COVID, and certainly the children have been blessed and spared. And I don't think we should take that lightly, meaning that we have, literally 20, 30, 40 of them at a small community pool playing together and take that for granted. Like, no, we got to be a little bit more careful where we have our kids play, smaller settings. We know they're going to want to get out, but less people. But likewise, if they need to go to the doctor because they're sick, or mom needs to have a wellness check, let's have you go on in and feel confident that, okay, maybe I'll just book it a little bit earlier in the day if I'm concerned that the clinic may get a little busy. And then, let's be honest, the doctor a little bit late. So that's also what tends to jumble the patients a bit when the doctor runs behind.
Right. Well, one of the things I wanted you to talk about is also parenting during this pandemic, because we know that kids are at home with the parents, and parents are pulling their hair out. And I guess what? God bless those teachers. So, but what advice do you have for parents with children during this pandemic?
Absolutely. Well, those people that know me personally, and certainly I don't mind people making sure that they like you, and if they want to holler out, that's fine too at me. Know that I try to be as involved as I can be, and I keep it real with them as well. This isn't, oh yeah, he's off working and I don't connect. No, sometimes the kids are at work, again, appropriately so, but certainly they're a very big part of my life on a regular. So as a parent, more so than as a doctor, I think that there's no question it can be stressful. And what we're doing, and I know a lot of parents are, so I'm not saying anything that people don't know, is keeping it moving and keeping it different. We're walking different paths, we're playing different games, we're out in the backyard, we're going over here, we're trying this pathway or park that we haven't been to before. So really trying a lot of different things to keep them engaged, because these kids are young. As they get older, we know that they can usually have some time on their own and not necessarily need all the hand holding. But for really young kids, 2, 3, 4, 5, 6, they're on the go, they're moving, they're active, and it can really be a lot. So that said, now that almost every state is relatively almost completely open, and certainly will be at the latest by Monday, for the most part, we want people to get out as much as they would, and like with that social distancing we set in mind. That's just an honest and safe precaution. We kind of already laid the groundwork. This affects our communities more. We may or may not be able to get the test for various reasons. They're not perfected. It's costly. It's not covered. I'm not sure if it's available. And then now we're saying, hey, we're going to go out, and we know this disease isn't gone. The numbers are all over the place every day with the continued increasing tests that come out positive. We know we're testing more. So same thing, okay, I'm going to go out and be out a little bit more with my kids. I hear what he's saying. Let me just have that, precaution of, okay, I was doing it before. I cross the street when I see a group of people, might be a family of 4 coming towards me. We do that. We don't want to be in their way and run into them and be too close. And likewise, when we go to the parks, we kind of scope it out, and there's 6, 10 people there, we're going to go hang out. If there's 30, 40 people, okay. We may avoid some of the surfaces. So I think that just really interacting with the kids, you name it, we've done it, from doing sports activities together, jumping jacks and yoga exercises and things like that, to getting our little sing-along mic and doing some of that. So we've tried to keep them engaged, but also we go out on the regular, 2 or 3 times a day, because kids don't like to be cooped up for so long.
Right. And it's hard to keep them, in a confined space for a long period of time. We have another question. What is the difference in risk of contracting from person-to-person transmission versus from a formite surface? So from a surface.
Right. So as your listeners are clearly keeping on top of the news, this also has been debated a lot just over the past week, sort of beginning of the week, before some other issues took precedence, which, we feel very badly about. The surface and how significant was that. So long story short, I tell people all the time, everything I needed to know about health and medicine, grandmother told me. She told me to wash my hands. She was the first doctor that I had. She told me to make sure that I didn't put my hands in my mouth. She told me, stop touching your face and picking your stuff, boy. She told me, you need to take off your shoes when you come into this house and show some respect. And the list continues. Exactly. And it's a lot of those same things. I mean, and that's what we love, but also sometimes sometimes can sit back and say, well, that's so simple, that can't make sense. But you talk to anyone who's done food prep, and they know you don't mix all of your different vegetables and meats and things like that together. You're constantly prep, clean, prep, clean.
Right.
So that concept of sort of disinfecting, whether it's washing some fruits, especially smaller things, your grapes, your things that have much more of a thin skin to them, totally makes sense. And I think that when it comes to the surfaces, wiping them down. Now, of course, be careful. I've had calls, people calling saying that they poisoned themselves because they sprayed something really toxic close to them or inhaled it. Many people are going to use natural products, vinegar, tea tree oil, things of this nature. Soap and water, though, is so universal and so simple and so affordable and available. That's what the recommendations are always going to be. You're in doubt, you're out somewhere public for a bit, wash your hands as many times as you can. You have a hand sanitizer, that's good, but wipe down your surfaces. Obviously, high risk is your kitchen, doorknobs, things of that nature, public bathrooms. So all that to say that I think one can certainly take it to an extreme where you're literally wearing, the big suit, the space suit and things like that, and gloves, and you can't go out into public without, even yelling at every single person that you see that's in violation. I think that's a bit of an extreme. Conversely, I've seen some of the memes that are extreme themselves where people are wearing clothes that aren't intended to be masks. So that might be a little bit too far the other way. So we're trying to stay center and tell people, sometimes they say 3 W's. So washing your hands, waiting at a safe, distance, and then sort of, watching sort of where you're going and things like that, wearing the mask. So wash your hands, waiting at a safe distance, and wear a mask.
Okay, we have another question. Can children get tested too, or is it just adults?
Sure, kids can get tested. We just, without trying to sound like we know everything, because we have to be able to admit there's a lot we don't know, they're just not really considered high risk. So that said, those of you that are really, super into trivia know that about a week and a half ago, we started to get this pediatric form. We're not even sure that it's of COVID. We're now maybe 150 kids, predominantly most of those cases, as you all know, were in New York. We're not even 100% sure that it is COVID, but for sure the kids were sick and not presenting in complete good health. As we should finish the epitaph, almost all those kids did fine. There was really less than a handful of kids that did not survive this pediatric inflammatory multi-system disorder, as they're sort of still trying to outline the name. But bottom line is that when we talk about the amount of kids that we have in the country, whether they're going off to some type of a camp or to school, and certainly into public spaces, the ability to test all of them, we don't have the ability to test the adults, let's just be honest. Those that need to, that are working in high-risk settings, daycares, nursing homes, skilled facilities, hospitals, where you have adult daycares as well. So it's very hard, and then frontline workers across the stream, to think right now that the kids can or should be tested, especially if they have no symptoms.
Yeah, and like you said, this is continuing to evolve. That is the operative word. It's evolving. We just don't know. When I see that, camps are open, and the kids are coming from different households and different communities. So there's just so much that we still don't know. So we still have to use caution with all of that. But with that, let's talk, switch gears for a moment. We do have another question, but let's switch gears for a moment. And let's talk about suicide. Suicide is up due to the coronavirus. People aren't doing well with social distancing. And even back in 2018, suicide was actually the 10th leading cause of death. We know that it exists, but suicides have also increased when there has been something like a pandemic or some kind of major crisis. So can you talk about the effect or the impact that this isolation is having on our African American community?
Sure. Well, I can't do that without making a plug for a program we did with the crisis text line. And it's just like it sounds, CRISISTEXT line. So that is a free 24/7 service. 8,000 volunteers man those phones. They cover 3 countries primarily right now, the US completely, the UK, and Ireland. And it's available 24/7, no charge at all. There's nothing about insurance. There's nothing about, so again, the crisis text org. And the reason is because that's what I think is some of the underlying purpose of why we're doing this. We're trying to give people some real resources that they can go to.
Right.
Suicides definitely were on an all-time high even before COVID came along. It's been trending up, like you said, throughout 2018, 2019. And then, as you appropriately mentioned, add on a significant stressor, socially isolate people. We tend to be social creatures. We need love. We need hugs. We need to connect with our families, brothers, sisters, and each other as humans. We need to continue to learn how to do that better. We probably can't learn that too much as we become adults. I think we can learn a lot from the kids. We were talking about them and how willing they are, especially at younger ages, to just, you want to play with me? What's your name?
Right.
I had that shovel, and sometimes they may take and grab it too and we correct them, but the willingness to interact, we need that. And those are some of those underlying seeds of suicide that are missing. Anxiety, which we know can get the best of it. I think almost every profession out there would say that at least 30% of the clients they deal with, whatever it may be, there's an anxiety component to it that's driving. The person doesn't stop calling you about this, they text you about that, and so forth. So sometimes it's a cry for help. And the take home, I think, is really being able to recognize that need. I've really been concerned about somebody. I don't know, they're just on my mind, cousin Nini. Let me just give her a call. I haven't talked to her in 2 years. You and I reconnecting. So many people, literally every week, I picked up the phone, sent an IM, DM, whatever they like to say these days, IG, emoji, there's so many different words, but reach out and touch. And that song, which Diana helped popularize, is so critical that we continue to do, because many times that call literally may save somebody's life. Knowing that somebody cared and was just checking in on me and just wondering, we used to work together all the time, and we've been furloughed now for 8 weeks, and we were really good and close. And I have so many other things I have to do. How am I going to take care of employment situations? I've got paperwork to fill out with the government. I've got checks to figure out when they're coming, taxes to file. But let me check on her or him, because we were in touch all the time. That extra mile, I think every single one of us, whether I saw some people doing that, going door to door, knocking on people's homes that they may not have even known their neighbor or aren't sure, but, oh yeah, we have this church member, she used to come all the time, and who is that? What's her name? Let's see if we can figure it out. So those are the types of ways, even though they're simple, because when we deal with the complex of, okay, someone has told us, or we're really seriously concerned because we see this person heading down a bad way, we have to get the professionals involved. We really do. But then many times it's very difficult to figure out exactly how to do that. So I wanted to plug the crisis text line in that regard, because I think it's something that if someone's in a bit of stress, just annoyed, frustrated, angry, outraged, anxious, depressed, we all go through all these emotions, many of us almost every single day at varying levels. It's part of our coping mechanism in order to have enough stress to get to where we need to go to and do the things we need to do. But by the same token, it can get carried away with itself. And likewise, depression, there's always going to be a time where we hit a rut, our health may compromise, we lose somebody we feel close to, and it may not be somebody we really know. And we saw that with the death of a celebrity, and we certainly see it with the death of loved ones in our community. And I say loved ones, even if we don't know them, we feel that death, we feel that pain, and that hurts. And we can only take but so much hurt without an outlet. And that's where I'll end it. Whether it be prayer, whether it be meditation, whether it be deep breathing, there are so many strategies to help sort of get us out of our own head and thinking too much, and we need to use those.
Yeah. One of our viewers actually posted the National Suicide Hotline is 1-800-273-8255. Thank you for that. 1-800-273-8255. We've got a two-part question. The first question is, do you think it's appropriate for law enforcement to intervene when there's a large gathering, such as parks and beaches? And I know that goes to, that's been a hot topic.
Well, like I like to tell a lot of my friends, and certainly some may think differently, when the cops are involved, it's definitely time for me to go home.
Right.
So if I suspect, whether I know I'm there for a good reason, and I'm not trying to deny the need and the right to protest, but I'm there for a good reason. I listen to a lot of the first line people, and again, we're purposely trying to not delve so far into this topic, but it's so current, it's hard not to hint
Right.
at it. And I know this can probably get out of control, or I see us starting to get out of control. I need to say, you know what? It's time for Bro Man to check out. My life may be at risk for sure, the life of others. So one doesn't want that to happen, of course, at the beach. But how do we know? Because we touched it that, okay, there are a lot of people here. You know, I've driven around this parking lot 3 times just trying to find that handicap spot that I'm not supposed to be in available. You know, maybe there's a sign here. Maybe I'm getting a message. This is not the beach for me to go to. And luckily, for most states, and I can't say it's true for all, but those at least along the coast, there are so many beaches. There are so many parks, and all of those will continue to open. So to me, you already have that sign. You know, oh gosh, I got to Costco dang early, and there are 50 people lined up. Okay, you have necessities, you've got to go. You're going to socially distance and go in and take your turn, so be it. But conversely, okay, it's just really not the time. So I think that's the best way to have the approach, that places and things that seem crowded are best avoided, because yes, in an ideal, the police wouldn't get involved, and we know why. But likewise, if and when, for whatever reason, you are there, hey, I was here early, that last little piece to go back to our time, space, people, place, and getting in and getting out. Okay, I don't need to spend all day there. I really don't need to be in a setting where there are a lot of people or the crowds are continuing to increase
Right.
for long periods of time. I was out an hour, I was out here 2. For sure, maybe that 8 hours sunbathe somehow may work for you, although it's a risk for cancer. But in general, it's not a good idea. So I think those clues, and likewise, we'll end with the party, since that had come up in one of the earlier questions. I arrived at, you know, cousin Bobo's house, and he's got it going on, but I mean, I can't even breathe in here because there are so many people. You know what?
Right.
It may be about to go down, but I don't need to be here when that happens, because, you know, it's just too crowded. So I think settings like that, and you know, people want to get out, but they also want to be able to be in the mix. There's a reason why all the concerts and stadiums, believe me, they want to open them up, are not opening Monday morning.
Right.
They're starting to report back to training, but why aren't they opening those? Way too many people. So you go on a house party, you stepping out in the club, you go into this bar and whatnot, and it's crowded, the beach, however the setting may be. Let's not even wait for the police to show up, because I'm telling you, when I hear the roar, it's definitely time for me.
Yeah.
I'm going in that direction.
Absolutely. You're absolutely right. The second question is, do you think that there's going to be a second or third wave of COVID-19? And I've heard that kind of come up quite a bit in the media, and people are talking about it. But what are your thoughts, Dr. Lewis?
Sure. So we always like to be people of caution. In general, docs often feel like they're preachers, and we spend a lot of time around ministers because we do think about the future a lot, because so many people want us to sort of help them with what their future may be. And obviously it's from a health perspective. So we know that we're going to have a flu season coming. That's going to come regardless of whether it brings COVID, Rovid, Rona, or Corona. That definitely is what the winter holds. So we expect that most of our people who know they're at risk, and now that's been identified a little bit better, I'm a little bit older, my health isn't the best, I take meds for this, I have that diagnosis, to stay home, probably circa, you know, around November or so, going forward probably all the way till March, as much as possible. I'm going to get out this summer. I'm going to do some of the things to see some of the people, maybe at a distance, that I wanted to do. And then I'm not really going to be taking that, you know, trip around the holidays, or traveling so far, or being out and about as much as I might have been during the summer and the fall. So even if there isn't a second wave, outside of that, it is a hard call. We don't expect that we'll have a vaccination. We know. We do expect that we'll have some treatments, although they may not be perfect. And we think that also, because Sabatru, so many people did get infected, that for the most part, people will overall be protected. We just can't be cavalier about pneumonia. We could start citing celebrities, James Brown, P. Diddy's ex, Ms. Kim, of who got a pneumonia and succumbed to it. So this is something that can happen to people even outside of this particular virus. In the winter season, it's seen more commonly. So people are going to say, let's get our shots. If we can stay in, let's stay in, and let's, socially distance, especially as you go into the holidays, regardless of whether they officially call it a second wave or a third wave, or it doesn't happen at all. I'm trying to take care of me and my family. I'm going to practice safely because probably there are certain things that I don't need to, some holiday gatherings that, okay, I can pull back from those a bit. Or if I go and there's a few people and so forth, we're fine. If it really seems like it's crowded and off the chain,
Right.
okay, I'm not staying here long, I need to go.
Right. And that leads into one of the questions that I was going to ask you is, why do people seem to ignore the fact that this is a pandemic? And let me be real. Let me talk about Black people, okay? Because do they view it as it was? Hey, there was the swine flu, there was Ebola. It's going to pass. But it just seems to be that a younger generation tends to in fact, that one young woman we heard on Tuesday, when the woman said, the news interviewed this 22-year-old in Alabama, and she said, we all gonna die of something. So what's happening with this cavalier attitude, not even thinking about the fact that they're bringing or could be bringing something back to their parents, to their grandparents, to their siblings? And sometimes people don't know that they have an underlying health condition. It just hadn't manifested itself yet. So, can you talk about why, in your opinion, why do you think people tend to ignore that this is really a pandemic?
Sure. Well, I'll speak to something we've seen, which is that we are in a me, myself, and I, ride till I die, you do you.
Right.
And this has increased over the last 20 years. And let's just be honest, in general, because of a lot of extra wealth. And while many people may say, well, if I look at my bank account, I don't feel so wealthy, that's not always where I want to look. I want to look in the closets. I want to see the cars. I want to see the kind of things you have on your wrist and the kind of shoes that you wear and the kind of toys that your kids play with and that you have. That's what we call many times conspicuous wealth. No one's trying to throw shade at it. The point being that now we're asked to say, okay, you have your things and you got to where you got to, wherever that may be. Think about somebody else. That's a very big flip on a script, especially for younger people. But in general, we're seeing it even in some older populations. Many of them are happy to go out and protest and say, I have the right to. Absolutely, people have their rights and we can't begin to completely argue about it. But what we're asking people is to even rise above that and say, do you have a right to look after others? And can you think about your brother and your sister, regardless of their race, their ethnicity, and even regardless of their economic standing? Because while it may seem cool or easy to feel, oh, well, I'm not old, or I'm not this race, or I'm not that religion, they're not as important because I need to do me. What winds up happening with that attitude is that now I go and take something back to my grandmother or my aunt or my child or whoever it may be because I was really callous. So we realize that that comes a lot from the videos and a lot from this general wealth, like we said, that's happened in the stock market, that's happened in people's homes in terms of the value of their homes, that's happened from really feeling like you've arrived when you've worked hard to get that Coach, get that Michael Kors, get that Louis, get that Bentley. But this pull back and say, gosh, I grew up at a time where my mom, my grandmother sacrificed every single thing she could for me. That's why she's so important to me and why I can't let somebody call her name out in vain. My uncle, he wasn't my dad, but he acted like my dad. So it's looking after others and really going that extra step. You have your rights, absolutely. Can you see it as a benefit of having those rights? I often challenge my patients with their health. You're blessed to have gotten to this point with whatever health you have. Let's put a tremendous value. We can't put a dollar sign on it in terms of your health, such that you realize that protecting the health of people around you helps. If somebody can look after you, somebody can be aware if you're sick. You can teach other people, I stayed healthy by exercising. Oh, really, what do you do? Well, I play golf every day. I go for a walk, I bowl. So really, and likewise, oh, wow, I see that person's not doing so good. Let me go that extra mile and try to protect them. So that's really what it's about. It's about trying to look after, in this case, it's true, our older grandparents and aunts, uncles, and things like that who helped us most of the time get to where we're at. But there are plenty, sadly true, of younger patients who did get this. Many of them survived, and who we also have to look after 30, 40, 50, because some of them were tip-top healthy. and their stories are all over the internet and social media. And they're runners and athletic and things of that nature. Some of them are celebrities and household names. And we don't know exactly why they got it. And we don't want anyone to succumb to this. But I think there's a lesson there for all of us that,
Agreed.
yeah, you can go the extra mile if you're doing as good as you can to help someone else by being careful, by socially distancing, by wearing a mask, by staying away from settings where it's risky potentially to your health, but definitely to your loved ones for sure.
Yeah, thank you for addressing that, because that's really real. And in a lot of communities, and especially minority communities, you do have, second and third generations that are all living together, and that's really, really important to recognize that. And so for people who are tuned in, you have children, grandchildren, whatever, make sure that you're cognizant of that. You say you love me. If you love me, then you're going to make sure that you protect me and not bring that to me. Let's take another question. What's the risk to households when children go to daycare? And this is a big one, because I have this question. It always seems that transmissions between children is higher with colds, flu, chickenpox, strep throat, you name it. So how can you protect your child in someone else's care in your household when they come home?
Sure. Yeah, no, that's a very real question. I mean, and you have probably 50% of parents who cannot get back to work, cannot do many things they have to do, cannot keep their sanity. I mean, let's just be honest, with trying to be a teacher, a parent, a toilet trainer, and things like that all day long, and also keep up with other responsibilities that they have. So they're going to have to get back to daycare. Flip side, you have other parents who are really going to be afraid, at least for the next few months, if they can somehow pull it off between extended family or whatever, to have their kids in settings around other kids. Again, luckily the kids have done very well, but bringing them home, I think many parents are going to say, okay, no, you definitely will be washing your hands, and we're going to do some type of a disinfecting process.
Mhm.
At its most extreme, and this isn't, I think, over the top, and certainly most of us in healthcare did this, and I shared this story as I think a lot of physicians did, we essentially did a strip down. I mean, let's just call it what it was, which is that we would take off our clothes sort of as soon as we got in the house, not interacting with anybody
Right.
first, and go and take a shower, and then put some other clothes on. Some physicians did that before they left the hospital as well as when they got home. And there obviously could be a benefit to that. Others might say, well, if I had the clothes at the hospital and put them on and then left the hospital, because obviously the washroom is not right, at the front door. But bottom line is that many did that either before they left the hospital, and many of them do it, and myself included, when we got home. And so I think that parallel being obviously that for children, that's not unreasonable. Come in, get the hands washed and stuff like that. Let's take you upstairs. I'm saying wash the hands and things like that even before the shower, because it's like, okay, what kind of interact with the child, kind of get them upstairs and things like that. And I think that's one of the most important areas is that the hands get washed. So you do the shower, change out the clothes, and then at least one feels comfortable that, okay, they have been cleaned, so to speak, and the soap and water is so effective.
Yeah, I certainly can remember that when I was in the hospital working, and that was, at the time it was at the height of the AIDS epidemic, and patients weren't given right diagnoses. People were just dying of pneumonia, FUO, so fever of unknown origin. So, and those were the things too. Coming home, and stripping down and washing your clothes, and even before I could touch my kids. So that's interesting. One of the questions that has come up is, can you briefly talk about your practice? It sounds fascinating. so, so we'll get back to a couple of questions, but since it came up, can you tell people? I said you were a physiatrist, but some people may not know exactly what a physiatrist is and what they do.
Absolutely. Well, I tell people that I do feel blessed. This is not a shameless plug, because I have plenty of patients, and while I'm certainly willing to see others, I'm not trying to advertise in any type of way. I've gone around the country doing these programs. I mean, literally next week we've got Birmingham, which will be the second program, Arizona, Detroit, and Long Beach, that we're doing similar programs for those communities. And we've probably done about 13 prior to that. So all that to say that is all done just on wanting to share and calling on my doc colleagues to also share the information of their practice and how they're helping their community, giving them some answers about COVID. Anyway, this practice obviously involves what they call physical medicine, because that's a word people may be able to relate to a little bit. I deal with, like I said, people who are athletic now, that have injuries, and some of those are famous names that people have heard, and also deal with people who were an athlete, or as I love to say for my super seniors, we're athletes in our minds, because my oldest patient is 104 and 104, and so my youngest patient is 12. All that to say that it's all about movement, and that movement is literally and figuratively. I'd like to stretch my patients and teach them how to stretch. Some of them obviously exercise more than others. Some aren't capable of exercise, but also movement in terms of, can I move their case along to the next step? I feel as physicians, we have to take it upon ourselves to be honest that part of our job now has become, can I get you to Stanford for that consult? Can I figure out how I can get an expert to intervene in your case? I'll pick a patient that called from Washington, D.C. because her neurologist wasn't going to be available for 2 months, but she was fainting. And so I called a neurologist in Texas because, you know, I have a lot of background there, and got the consult because I'm not a neurologist, and got that work done, got the imaging ordered in Washington, even though I'm not there, got everything prepped so that when she saw the neurologist, she walked in the door armed and ready. Here's all the information. I've already gotten a subconsult, and here's the imaging Dr. Lewis ordered. So that's what I spend a good part of my day doing, which is trying to get people things figured out for their disability, figure out how to get them into physical therapy, get them the acupuncture, so forth and so on, but literally moving their cases along, moving their care along. And if that's something as simple as, okay, literally as we were going on to air, it was a patient that needed medral dose pack because she was having an asthma flare. And it's Friday late where she is. I think that call came out of Georgia. And so, you know, I wrote the script for her. So that's a movement because I don't want her to go to the ER if she doesn't have to.
Yeah. Oh, okay. Thank you so much. Also, not forgetting the pain. You know,
Right.
deal with pain management. But let me move on
Sure.
quickly. Let's talk about, we've talked about the inconsistent and the inadequate care of people of color. And in this case, since we're talking about corona, one of the challenges that I think that people have is to technologies. Like what you're talking about, you're doing what we call telemedicine. So people can get onto a computer and schedule an appointment and see you. And I see that Kaiser is doing that, Sutter, there are more and more of those things happening. But for people across the board that can't have a virtual doctor visit or access to medical care, it's close within the communities, because that's the other issue. They're in communities where there aren't medical clinics and hospitals that are close to them. So as it relates to the outcomes, I'm certain that we already know the answer to this, but just, you know, speaking on the fact that those outcomes are not going to be as good for those people who are in these underserved communities as it is for someone who lives in a community where they have access to this.
Sure. No. So it's a great point. So there are some organizations that are doing it for free. I'll plug at least one that's in the Bay Area, Health Tap, like it sounds, HEALTH, TAP, TAP, just one word. And they've done a lot of marketing about the fact that they provided free teleconsults essentially around the world. They cover most of the UK, Australia, Canada, and the entire US. And there's similar organizations doing that. So that at least will exist for a while, where some services are providing it for free. I do tell people if they have insurance to dig into that, because like you said with Kaiser Sutter, but all the big ones, United, Blue Shield, almost all of them have a teleconsult option, usually which is already covered in your plan. They want you to do that. Most of them, there's not a copay. But drilling down to communities where there's no question there's a lack of resources, I'm always trying to get people to literally feel comfortable enough to go to their local community hospital, regardless of what their clinical or insurance situation may be, because they all have arms and social workers and people who are available to help you get the care that you need, regardless. And without trying to make it sound like a point to exploit, very few organizations are going to take you to the actual full-fledged collections,
Right.
that's your credit report and things like that, when you were accessing medical care and you didn't have the means. That said, again, like you mentioned with the ERs, we don't want people to try to take advantage of it. Okay, I know that I could pay something, but I'm going to, come in and really try to take advantage of the system. That's, I don't think, the best. But when people have care and they have a need, really realizing the resources that are available at your local, hospital is
Mm-hmm.
significant, because they almost all have social workers on board who work full time to try to make sure they're doing instant applications for Medi-Cal or TennCare if you're in Tennessee. It has different names, but as we travel around the country, but they have the resources. Likewise, and last but not least, for the sort of community resource clinics, we have one obviously in West Oakland. I've just been talking to people over at Watts down in LA. These community resources also exist to do the exact same thing, prevent the need to go to the ER, at least by getting a primary and connecting you. We have Healthy San Francisco as a plan. All employers pay for that, all restaurants pay for that, all hotels in San Francisco pay for it. Many cities have enacted something that's similar as well. So I'm not trying to make it sound like everybody possibly can be covered, but for sure, there's a lot more resources available. And you'll often hear these organizations saying they're not at full capacity. They still have the ability to take another patient or two on per day. We're not talking about in the whole year. Every day, doctors have cancellations every day. So with that in mind, taking ideas and speaking them into reality, I work hard to get all my patients that need to be seen at Stanford, and those that prefer to go to UCSF, to UCSF. And likewise, the few patients that I have in Ohio and in Connecticut, likewise to Cleveland Clinic and Yale. Because again, not trying to make it sound like it's all about the names, but those are government-funded organizations. Code word, we pay the taxes to keep these places open. They all accept all of the insurances, and they are not. And I think, again, it's something that we claim and we make the case. You're not going to financially try to ruin me because I needed medical help, and the doctor helped get me there. And again, I think it's a thing of being honest. I don't think you walk off and get in your Mercedes and you're like, I'm not paying that bill. No, I think it's okay, let me work with them if I have some means, but if I need to be seen by an expert because I can't get the answers I need from my doctors, no, I know that there should be doctors like Dr. Lewis out there trying to get me to the experts, because some cases are complicated. It's true.
Right. Absolutely. And as a reminder to the people who are tuned in and want to make this point, just what you said, one of the things I'm going to reach back into just talking about the churches were the first original newsletters, newspapers, because everything that happened, people in the church knew about it. And we need to somewhat kind of go back to that, talking about what are the resources that are available, how people can get help, and realize that you may not have the money or the means, but I think if you really just ratchet it all the way down, people would rather that you get care and get taken care of as opposed to walking around spreading it, because that's one of the issues where we see in the spread in the meat packing plants and some of the other areas, because these people are in communities where they feel that, one, they don't have not only not have health care, but they don't even have sick time. So they're going to work sick. These are people who feel like I've not been able to get in to see the doctor, and I know that I can't afford to take time off because of an economic impact it's going to have on my family. So we need to get back to letting people know, here are the resources. Here's where, just like you used to know where to go to get that government cheese and peanut butter, then you need to be able to share that and make sure that people are aware. So thank you for sharing that. One of the things that's come up is people talk about being vaccinated against COVID. Can you speak to that, and let's put that dog to rest, if there are vaccines that are currently available for treating COVID?
Right. So the medical community's hope is that there will be a vaccine in 2021. I think almost all of us stand united in the fact we don't want it to be the case that this year we will not have a vaccine out. So I'm trying to be specific about the year because it takes so much testing to make sure that it really works.
Right.
And you'll hear that everyone has, even physicians themselves who go to get a shot. Oh, I got the shot, I got sick. Oh, I got the shot. It didn't help me anyway. I got the shot, but I don't need it. So people are concerned that the shot got me sick. I mean, let's just call it a spade. So all of those concerns are real, and I think the medical community does hear them. And they also know without us being in denial. There's tremendous liability out there.
Right.
You can't rush to have a vaccine made available and then find that there's a significant number of people that it didn't work for, they got sick, because you know what starts to happen after that. They're calling their attorney.
Right.
And so those are realities. There's numbers to that. There about $100 million was paid the last time a vaccine was rushed and gotten out there by the government. And the companies are going to ensure that they have protection from the government when they roll us out. And so that's a lot of stuff that's happening behind the scenes. More important to the question is the fact that at least 3 gigantic companies in the US with several companies that are overseas are trying to work together to come up with a treatment. That's news to our ears and something we like hearing because we know this affects other countries.
Right.
While we know the US has certainly carried the lion's share of this, by the same token, it's not like our brothers and sisters in other countries haven't been affected and aren't continuing to be affected, and that their numbers won't go up. And we know, we see this happening all over, particularly in Brazil right at the time. So with that in mind, that's what I think people can, at least in the short term, see maybe on the horizon, that it's not just, oh, that US company is just trying to exploit this and make money out of it. No, companies are working together collaboratively to try to share. And also they're already thinking about another question may come up, which is making sure that it's available to those that need it the most early on, as opposed to one company sort of running away with the patent and overcharging all the other countries.
Okay, all right. So our time is we knew that this would, and this is just getting started. So you guys, look, stay tuned. Dr. Lewis and I are going to be making an announcement because there is so much more that we need to cover, not just COVID, but just period across the board when we talk about healthcare. But here's a comment that one of the viewers said: maybe we should really rip the Band-Aid off. As African Americans, we are in a pandemic every day of our lives. Now that Asian Americans are walking in our shoes, there is this buildup of tension that makes some of us step and not take COVID serious. So, and they're asking if you wanted to comment on that. And if so, you know, we're at 91 minutes, and which has been a great discussion, but we want to make sure that we try to cover as much as we can.
Right. Well, I mean, cut us again if the Band-Aid gets too raw. But no, it's for sure. We face a pandemic from all sorts of avenues: financial, racial. This is one that's medical. It's not the first health issue that's come up, or any be the last. And I think we do have to do that. We've got to be responsible for each other. And conversely, we know in our community sort of not to turn on our Muslim brothers and sisters, our Asian brothers and sisters, as we have seen happen with various issues that come up. That's from a place of fear and certainly ignorance. So we don't condone that. Yet still, we see it as a right and a privilege, something that we are teaching this country, that we continue to stand strong and proud about. It's our heritage that not only we admire and value so strongly, but that everybody's trying to copy in terms of our swag, our style, our grace, our ability to stand strong despite challenges. And so, and even, you know, emulating many of our leaders. So being proud of that. James Brown, I think, said it the best, you know, I'm Black and I'm proud. And say that confidently, regardless of how many don't hear it and how many do. That's something that is our heritage to have regardless. And so I think that as we continue to tell our kids that and have them understand it, not in a mean way, but in a constructive way. I'm proud of who I am. There's nothing you can say that tells me that I'm not great and that I wasn't born into greatness. Now I've got to work and I've got to play this game and I've got to do certain things in order to sort of be accepted in society, many of which I may not want to do, and many of which I don't even, you know, feel I need to do. But yet and still, I'm confident of who I am every single day. And as I support my brothers and sisters, literally, we start to become that choir that we feel really sort of bands together to really be a unified voice, as opposed to this person's going off over here and that person's saying that over there.
Yeah, absolutely. So, Dr. Lewis, my last question for you, and it's two-part. First of all, what should people who've been tuned in take away from our time together today? And then the second part of that is to tell people how they can contact you if they want to make an appointment and they're in love with your practice.
Well, luckily my name is pretty unique. Moshe Lewis, Lewis. So as a physician there, I don't think there's almost anybody else in the world literally that has that name
Right.
live practicing. And so that's good. So it's very easy to find me, and I'm very active not only on social media, but you can find me on YouTube and things like that. We're in the process, without trying to pre-announce it, of working on a show, calling Dr. Moshe, to really kind of deal with the fact that I get calls literally all day and all night, sometimes to my wife's disdain. So anyway, I'm pretty easy to find in that regard. But more importantly, I think the take homes are some of the key things we highlighted. Suicide continues to increase, and COVID just sort of helped push it that much further along. And it's a tremendous concern to our community, reaching out to people that are nearby that you may know or that you haven't talked to in a while, even if you're just sending them an instant message, even if you just send them a text, even if you're just trying to check on them through other contacts you may have, really helps people feel this love. As a people that should be proud of who we are and so many accomplishments that we've had. We can never, say we're going to accept this status quo, that
Right.
we're inferior or we're not good enough. I think that's a message, we can continue to pass on to our kids. And then for the COVID, because so many people have heard it, just some basic themes of the 3 W's we hinted at: washing your hands, waiting at an appropriate distance, and also wearing a mask, especially in settings where it may be higher risk. Being comfortable to say this seems a little bit too risky, whether it's for my own personal life or the safety of my grandmother. Seems like police activity, too many people, things of that nature. Let me stay away. I don't really need to do Disney right now. And then last but not least, in terms of a big theme, access to healthcare, we want, and I'm asking all physicians to be just as vocal in doing programs like this, making themselves visible in the community, in whatever sphere of influence they have. Maybe you're an ophthalmologist and you can only speak to things about the eye, but our community needs to know that you're out there and who you are and how to reach you.
Right. Right.
And that's what I want from the physicians that you may have watched it or heard about it, to feel comfortable to stand up and make themselves as available as they can, within reason.
Yeah. Okay. All right. So my plug is that I'm Gloria Bailey Ray. I am the host and producer of You Didn't Get the Memo. And that's truly what this was about. We're talking about the memos that people don't get. But at the same time, I want you to hit that little thumbs up if you liked and enjoyed this. I see some of you have already done that. You can follow me on Facebook, Instagram, Twitter. I'm Gloria Bailey Ray, and it's RAY. And also, you can check me out every Thursday from 6 to 7 p.m. Pacific Standard Time. I do a podcast called Real Talk with Lady G. If you got some topics that you'd like for me to discuss and bring Dr. Lewis back on and we deal with, you can actually send me an email to you, the letter U, didn't get the memo, just as it sounds. You didn't get the memo at gmail.com, and we will pull it up and we will get it going for you. Dr. Lewis also has a website that's www.ggiim.org. Did I get that right?
Yeah, you did.
Okay, all right. So you can check out his website. He's a dynamic man, and I just want to thank you so much for joining me and for us to talk about what is going on in the community. And I love the fact that we can have candid, raw, lit discussions, because that's literally what it is about. So for those of you who joined in late, I will be reposting this after we kind of clean it up a little bit. We had to drop out and some different things. But I would just encourage you to share this video with others. And again, follow Dr. Moshe Lewis, follow me, Gloria Bailey Ray. And I want to end this with just saying, guys, remember this: the quality of your life is determined by the decisions that you make. So thank you so much for tuning in. Until this time next week or a couple of weeks when we come back on, we'll definitely make sure that you know about it. Tell a friend about us, follow us, be well, be blessed. Fondly, Gloria, Dr. Lewis. Thank you so much.